Warning. The following video contains strong language that some viewers may find offensive or disturbing.
Doctors of Reddit. What patient made you go? How the fuck are you even alive? I was on home call for in a small town. Got a call from the nurse one night and she was like, "Ems brought someone in here and they think she might be dead?" I was like, single quote dot. "Well, is she?" She was like, "I don't know." Single quote dot. This was a seasoned RN. By the way, so I was like, well, guess we're treating this as a code blue kind of situation. So without any further information, I jump into my car and rush over to the hospital. Once I got there, I realized why the triage nurse was so confused. In the trauma bay, lay what appeared to be skeletonized remains under a blanket. The person felt warm to touch. So I opened their eye. And a yellow, wrinkled, shrunken eyeball stared at me and then suddenly moved. Potassium of 1. For those familiar with lab values. The backstory was extreme self-neglect, depression combined with caregiver neglect. Weighed in at 67 pounds at a height of about 5'5". We actually resuscitated her, very aggressively, and unbelievably, after about 8 liters of fluid. She started speaking a word or two at a time and recognized her daughter. For those like me who are curious, potassium levels of 3, 6 to 5, 2 is normal, anything less than 2, 5 is life-threatening, seems like a relatively wide range for normal, but it doesn't take much to get into deadly territory. That's kind of scary. I'm going to go eat a banana. We had one of these at an eye doctor's office of all places. Patient was complaining about how her new glasses weren't working, so the doctor took her in back to check to see if the prescription needed tweaking. The doctor came up with a completely different prescription. Patient was overweight but claimed she was not diabetic. The doctor convinced her to let us take a blood sugar measurement with a staff member's personal glucose meter. All the meter displayed was high with some arguing. We were able to get her to go to the local hospital right away. I don't remember what her blood sugar level was, but I remember it was the hospital's high score for a while. She should not have been conscious, let alone functioning normally. A couple pictures of me before and after brain surgeries were on the front page around this time last year. The mortality rate for acute subdural hematomas is 50 to 90%. Of those who live, approximately 20 to 30% regain any brain functioning. Due to the subdural hematoma, the bleeding in my skull was so severe that I also had cranial herniation. My brain tilted 5 millimeters, causing my brainstem to compress into my spinal cord. That I not only lived, but woke up, and recovered well enough to go back to work, get married, travel the world, return to baseline physically is a straight-up medical miracle. I'm still in touch with the neurosurgeon who was on call at the hospital that day. And he says the same thing. Patient here. When I was 2 I was being treated for asthma due to wheezing, labored breathing, etc. One night it got exceptionally bad so my mom took me to the ER. They put me face down to do a CT scan, this was 1990, and when they were done, they turned me back over and I was blue. Had stopped breathing. CT revealed a volleyball-size mass in my chest. Emergency surgery revealed what was supposed to be my twin. It kept growing inside my rib cage and finally had nowhere to go in my toddler body, so it cut off my airway. It had fingernails, hair, appendages. Everything but major organs. I made a full recovery. I am a healthy 31-year-old now. 0 asthma. Only remnant of that night is a scar that goes from the center of my chest to the center of my back. Update: definitely didn't expect this to blow up. Damn. Thanks for my first gold. This was a teratoma. So it was never a viable human. Edited the post to show that I am the healthy 31-year-old. Lol. Anybody that quoted Dwight Schrute as my hero. Lady in her mid-30s was in the clinic for a 1-week follow-up post-foot amputation, diabetes. She was admitted straight from the clinic because her blood glucose was 600 milligrams per deciliter, normal is 80 to 120, and the wound was severely infected. We used super concentrated doses of insulin to bring it back to the 200s. She was on strict diet restrictions and we couldn't figure out how it wouldn't drop any lower than 250. Turns out her kids, teens, had been sneaking giant 64 ounces sodas and candy bars into the hospital. Literally 1 week after we chopped her foot off because of uncontrolled diabetes. Not exactly a case of, how the fuck did you survive that trauma, disease, but, how the fuck do you even function on your own? During residency, my ICU patient had to have his chest reopened less than an hour after 6-hour open-heart CABG surgery. He needed 12 units of blood. His heart massaged then shocked 4 times. Cardiothoracic surgeon in the ICU operating because no time to go back down to OR. Was an illicit drug abuser and alcoholic. Nurses called him the cockroach. I checked in on him for 4 weeks. He was unresponsive every day. On week 20 we had to consult ENT. To take maggots out of his nose. I was sure he was a goner after that. Week 3 passed. No change. Week 4. Day 24 I believe. At 6 a.m., he opens his eyes. I was shocked. He has a permanent tracheostomy now. But somehow is alive. Veterinarian. Dog hit by a train. It severed the dog's leg and the dog carried its own leg home. Owner brought dog and leg to the ER. Edit, leg could not be reattaches due to significant damage to limb. Dogs do great as tripods though. Currently in residency, but this was a patient I saw in medical school. This one has more to do with a patient's past medical history instead of anything acute. Had one patient in one of my internal medicine rotations who was admitted for hip surgery who was one of the nicest sweetest people I've ever met. Her surgery was pretty routine and there were no complications. In her past medical history, she was diagnosed with stage 4 endometrial cancer that had spread to her brain. Apparently she had undergone chemo, radiation, primary tumor resection, and surgery to remove the brain met. She remained cancer-free since that period. The fact that she had undergone that whole ordeal and appeared to be mostly healthy and was in remission from her cancer really blew my mind. My father's doctor couldn't believe he didn't need to amputate his feet and he was still alive. Dad had brittle diabetes. His pancreas would kick in and out due to a congenital deformity. At 82, he had significant heart issues, including angina, enlarged heart and clogged arteries. One day, his feet went black, not just bluish, or gray, black as charcoal, rushed to emergency. We were told they would amputate. But to say our goodbyes. Dad refused surgery, said he'd rather be dead. At his age, hours later, his feet were pink. We took him home that morning. Doctor actually apologized for upsetting us, but said he'd never seen anything like it. A guy the first took care of during my residency. Fucking cyborg. I was the chief on trauma. Got a page about a patient en route with a stab wound to the chest. When the patient rolled into the trauma bay, he had no pulse. He had been stabbed in his left upper chest 3 centimeters below clavicle. He got an thoracotomy if you want to feel like a badass. Then do an thoracotomy. We were able to cross-clamp his aorta. We took him right to the OR. We oversewed one small artery below his rib. Then transported him to the ICU still intubated. 8 hours later he was extubated and wanting breakfast. Seriously, dude? He was dead 10 hours before. He was also a complete asshole. No wonder someone stabbed him. I work in trauma and once had a guy fall off a roof. He said he remembered hitting the bars on the scaffolding on the way down. We originally thought he'd fractured his femur but nope, just a small hematoma. He was in bed next to a man who had broken his ribs and had a small C-spine fracture when he fell forward picking up his keys. As a med student on my emergency rotation, I had a guy brought in who had fallen off a 7th or 8th floor balcony and landed on his head. Essentially DOA, and we couldn't get a blood pressure when he got to the hospital. As a student, my job was to basically stand to the side and squeeze the bajillion bags of blood that went into this dude. His cervical spine was essentially dust on the initial CT scan we got. I figured he probably wouldn't have made it, but about a month later I'm now on my ICU rotation and I see this guy awake and conscious. Pretty crazy. We had a guy with a major aortic dissection one night. From the bedside ultrasound, he looked like he had already bled out. He had some chest pain, but he was alert and oriented. And we were shocked he was even still alive. He absolutely shouldn't have been with how much blood we saw and the size of the dissection. We called the surgeon in, who was really blunt, and explained to the guy he was probably going to die in surgery. He was a young guy, like late 40s. He was on a business trip, and it was completely unexpected. He kept trying to call his wife, but it was like 2 a.m. and she wasn't answering. He just wanted to talk and tell her goodbye. It was actually pretty devastating to watch. Meanwhile he's so coherent and alert as if he isn't actively bleeding out and dying. Most patients we would get in the same situation wouldn't be conscious or would already be dead. They swooped him off to surgery before he could contact his wife. And the dude lived. Remembering that story got me through a lot of tough years in the ER. Because I think it just reminded me that hope and good outcomes are still out there. Edit, geez. This blew up. I picked up my phone this morning and had no idea what happened. Thanks all for the awards and the interesting discussion. To those of you with similar stories, know that you are the reason a lot of providers keep doing what they do. Some of your experiences are unbelievable. I'm still trying to read through all the comments. To clarify some things, late 40s is young for this kind of case to happen. We usually see people dissect in their 70s to 90s. Also late 40s is a pretty young age to die, especially if you don't have any chronic illnesses. A couple of weeks ago, my Ed lost a 30-year-old to COVID-19. A couple of nurses cried because we consider people twice his age still pretty young. This happened when I was still a tech and had only been in the ER for about a year. He was brought in by EMS uncomfortable, but definitely awake and alert. His ECG was normal, and he didn't have any pertinent history, just chronic HTN and a few minor surgeries. But he was hypotensive and really pale, and when we performed in US, we found a huge volume of blood in the abdomen, and a visible intimal tear. We pretty much immediately diagnosed him with AD and had vascular surgery in the room within a few minutes. I followed up on his chart a few days later and found out not only that he was alive, but he was already extubated and able to walk. I'll try to keep sorting through comments. I'm surprised that this isn't as uncommon as I thought. My dad is 87. He had prostate, liver, bowel, colon and skin cancer. For the skin cancer he had lots of reconstructive surgeries. His whole tibia region and the back of his hands. Every year he has to have at least one skin lesion removed. He had a couple of heart attacks and then a sextuple bypass surgery. He also had a big pneumonia, a huge abscess and a small stroke. His doctor wants to see him every 6 months. I think just to be amazed that he's still walking around. My mom's a doctor. I asked her about this when it came up on Reddit, when my mom was in her cycle during internship. Man with police officers behind him came in the The man was perfectly fine and walking. So my mom and her colleagues were confused. The officers showed them a picture of a crumpled metal piece, which was a car. It didn't look like a car at all. Just metal trash. The officers told my mom and her colleagues that they rescued the patient from the car, which was lit on fire only a few seconds after they rescued him. The patient didn't have a single scar on him, was perfectly fine, and got his name around the hospital for being immortal. Single quote. Obligatory, not a doctor, but my dad is, and he liked to tell us about the crazy shit he saw. This post made me think of one of those in particular. Huge guy, linebacker build, came into the trauma ward with a gunshot wound dead center of the chest. He could breathe fine and he had a pulse. So they did a chest x-ray and found that the bullet had spent all its energy getting through this guy's sternum and was just resting on his pericardium. Airlifted pregnant female with GSW to the head. Arrived intubated and non-responsive with the bullet lodged in her right occipital lobe. Self-extubated the next day and left the hospital against medical advice 2 days after that with only minor visual deficits. Unbelievable. Not a doctor, but I had a few doctors ask me that. Typically, if you get appendicitis, it'll rupture and sepsis will set in within a day or so. And when that happens, it gets real bad real fast. So I got appendicitis. It freaking hurt so bad. But I didn't know I had appendicitis. I went to the doctor. He couldn't tell what was going on. Though I had compacted stool and wanted me to take stool softeners. So I did. It didn't help. Cause spoiler. It was appendicitis, right? And then a roommate who thinks he knows what he's talking about tells me that it's all in my head and I just need to physically get off the couch and exercise. Because he feels much better after he exercises. Okay, dude. I can't even get off the couch to use the restroom without almost passing out in pain. He tells me to just play a video game to get my mind off of it. I go to class, grad student at the time. I call the doctor and make another appointment. He doesn't know what's going on. I talk with another doctor. No clue, he thought maybe it's appendicitis. But I didn't have a fever and didn't have a recoil pain. So maybe it was gastrointestinal stuff. So I schedule an appointment. Meet with them. All the while I'm going to class and taking the maximum dosage of all pain relievers I can get my hands on. And finally the GI doctor's scans showed that I had appendicitis. Hooray, I go to the nearest and I say, in a totally calm tone, "Hi, my name is less than insert name here. Greater than so. My doctor said I should probably go to the because my appendix burst a while ago and it should probably be taken out or something." Turns out, my appendix burst and I held onto it for 3.5 weeks. I had a dozen doctors come in. And some of them even started by saying, "Hello, my name is Dr. Such and Such. And I heard that you're the guy who has had a burst appendix for nearly a month and you're still alive. I am not on your case. But I just wanted to meet you. How the hell are you still alive? How the hell did you drive yourself here and just waltz into our I got that alien bioengineering upgrade where the abdomen moves around and wall seals off the burst appendix so it doesn't leak everywhere. Edit, after my primary care physician learned I had appendicitis and he didn't diagnose it. He retired within the month. It was probably coincidental. I had a patient who was literally cut in half at the pelvis after a car hit him and pinned him to a telephone pole. Paramedics carried his legs in separately. He was wide awake and talking to me as we quickly put in a central line and he got all the bleeders ligated by like 5 different surgeons. He declined pain meds repeatedly. What a legend. He was in the OR 5 minutes later. Luckily this was at a major academic center with an exceptional trauma surgery team. Apparently the guy lived. Not sure what his quality of life was after. But pretty crazy. Thanks for watching. If you liked the video, give it a thumbs up. Don't forget to subscribe and hit the notification button. See you next time.